In our health news today, a look at a novel way to correct what is a common problem in infancy before it becomes a problem later in life. All babies are born with soft spots on their skulls, typically at the top and the back of their heads, but areas allowing that brain to grow. But if babies are left on their backs for too long, those indentations can actually become permanent ones, which is especially concerning for boys who will end up having shorter hair. Correcting the problem later in life used to involve an invasive surgery, but now a South Florida plastic surgeon has found a solution using a customized 3D silicone implant.
In general, these silicone implants we use for skull shaping are firm and they are not gel-filled like silicone breast implants. So they typically last a long time, hopefully the length of the patient's lifetime, and hopefully never have to be replaced.
So Dr. Lampert says routine tummy time in infancy can really help to avoid the problem altogether, and special helmets can be worn to help close up those gaps. But there is a limited window of time before the bone fuses and hardens.